Welcome back, everyone. It's time for some girl talk. There are many different reasons that women seek fertility treatments, but is it the right choice for you? We're going to answer that question and many more in today's Girl Talk. Well, it's that time again, time for a little girl talk, and today we're talking fertility. We're covering all of it with Dr. Joseph Garza. He specializes in infertility and reproductive endocrinology. He's with the Advanced Fertility Center here up in Stone Oak in the new office, which is lovely, by the way.
We're still sorting out boxes. Yep.
But you'll be in here eventually full time.
Absolutely, and we'll move our in vitro laboratory probably in the spring or summer over at here.
I know there's so many different reasons that you see patients when it comes to fertility, but what are the most common reasons that women come to see you?
Well, usually, if a couple hasn't been able to achieve a pregnancy in 12 months of trying, then it's time to start doing some basic medical evaluations. But ladies who've deferred fertility because of education or career, if they have a cancer that they've just been diagnosed and they want to preserve their fertility, we may need to talk very quickly and keep their options open. A lot of the chemotherapy agents will destroy the ability of the ovaries to make new eggs.
Where we've gone with fertility just in the last decade is amazing to me because it seems like stuff we were going to see in the future, but it's happening now. It gives people a lot of hope that are going through these hard
Absolutely.
times.
In the last 7 or 8 years, the method that we now use to freeze embryos and eggs has greatly simplified, but been much more successful. Before, you'd have to fertilize an egg and then freeze it because the egg wouldn't survive by itself. But with the new vitrification procedure, a lady can elect to freeze her own eggs for whatever reason she desires and not have to decide on a partner or a sperm donor. And then later on in life, then she can have a baby, and the risk of Down syndrome is that of the day of the year that she froze her eggs.
Again, it's amazing. What's the process like? So, you have a patient come in and she says, I'm 35 and I eventually want to have a baby, but I'm not quite ready yet. So then how does that work? What do you do?
Well, you do some basic hormonal evaluations to be sure there's no underlying disease. And then the lady starts some injections to produce more than one egg, because Mother Nature tends to produce only one egg a month. And we want to trick her into giving us more. So after, say, about 10 or 12 days,